Hello and welcome. My name is Whitney and I'm an anesthesia intern documenting my journey as I go through my first year of residency. I am currently on my general surgery block that I'm doing my intern year, and I just finished up week 2. So in my previous video from last week, I talked a lot about the day-to-day schedule and work that we do, what's involved with the different parts of the day. So for today's video, I just wanted to add on a little bit more to what we do throughout the day. I will say a lot of the bulk of what we do is mentioned in that previous video, but there's a few other things that I didn't mention there that I thought might be helpful to hear about, the other parts of what goes into a day on the general surgery service. So I'll go ahead and talk about that. And then, as always, at the end of the video, I will go over how many hours I actually worked this week. So let's go ahead and get into it. So the first thing I want to talk about is something that I actually mentioned in my video from last week. And that is this idea of consults, or, like getting consults. So I just mentioned it briefly as something that we're doing throughout the day. We're just, waiting around for consults. And I really just wanted to define what that is, what it looks like, just in case people have never heard that term before, or if they've heard of it but don't really know what it means. All right, so to explain what consults are, I first want to take a step back and give a little bit of background about the hospital that I'm working at. So at the hospital that I'm working at, whenever a patient is admitted to the hospital, meaning that they've been hospitalized, regardless of what problems they have or, like anything like that, they will always be admitted to a internal medicine doctor. So they are admitted to the general medicine service. From there, internal medicine doctors, they can take care of a lot of problems, but they can't take care of everything. So sometimes they need specialists to help with the patients. So the internal medicine doctor, or who we kind of refer to as like the primary doctor, will then ask for consults from different services for different specialists to come on board and to help with the patient care. So on the general surgery service, being consultants, we are waiting to hear from the internal medicine doctors to see if they need us to come see a patient. So when we are consulted, what we'll do is go and talk to the patient, get all of the history, their story, information, and everything like that. But it's a lot more focused. So it's kind of nice because we can just go in and narrow in on the surgical problem at hand. So for example, we saw a lot of things like gallbladder disease, appendicitis, small bowel obstructions was something that we saw a lot of, and even things like ischemic bowel are all surgical problems. So we would go and talk to the patient in regards to those kind of symptoms and problems that they're having. But if they had other things going on, like let's say they had like an acute kidney injury or pneumonia or altered mental status, like anything else that the patient could be experiencing, we're not the ones managing that. So it's really nice because we can just focus in on the problem that surgery has to work with instead of looking at, like the entire patient as a whole. So it has been kind of nice because I feel like it's not as overwhelming when you're working with patients. You can really focus in on just what you need to. And it is nice because it might be like a little bit less work, but I feel like for me, it's been easier to pick up on things and to actually learn just because it's not as much that I have to focus on. I am really able to just narrow in on what needs to be done for the specific service that I'm on right now. If you watched my video about admitting while on the internal medicine service, this might sound kind of familiar. And I will say that having consults and admitting patients are actually pretty similar. The one difference I would say, though, especially being on the general surgery service, is that the information that you need and kind of like the interview and everything like that you do on surgery is a lot more brief than it is with the internal medicine service. In terms of like the HPI, you're not getting the most detailed. You're really just getting a more basic understanding of like what symptoms are they experiencing, how long has it been going on. It's much more basic in that regard. We don't really care about like every surgery they've ever had. We really just want to know, like, have you had abdominal surgeries or any like recent surgeries? We might not need to know like every medication that the patient is on, but like knowing about blood thinners is really important. So yeah, overall, I would say much more brief and simple on the surgery service. And I think I'm going to miss it when I'm back on internal medicine just because it's really not, I don't know, it doesn't take too long. And I feel like it's a lot easier to get through in terms of like speaking with the patient and doing the physical exam. So I will miss it, but that's okay. I want to bring up one last thing when it comes to consulting. I touched on this briefly before, but I do just want to make a little bit more of a point about it. When I said, like at my, or where I'm training at right now, at the hospital I'm at, it is protocol for every admitted patient to be admitted under the internal medicine doctor, and they're like the primary care, and they consult out to the different services, including general surgery. I will say that this isn't how it is at every hospital. So, for example, at the hospital I was at for medical school, where I worked at, it wasn't quite like that. Like if a patient came in and they needed to be seen mostly by like a general surgeon team, the patient would actually be admitted to general surgery. So they would be considered like the primary care patient, and they would be, working up and managing a lot more of the different problems that a patient had. So I do just want to say that it is a little bit different everywhere. Being on a consultant service is a little bit more, I would say, relaxed in terms of like not having to know every little nitty gritty thing about a patient, but you might see more patients overall. So relaxed in the sense that you're not as involved with each patient, but you are still seeing quite a bit of them. So the fact that the general surgery service here is a consulting service is kind of nice, but that is not the case for everywhere. So I just wanted to make sure that I made that clear. So that's really all that I wanted to talk about with consults. Really just defining what it is. Like I had mentioned in my previous video, there's a lot of variability in how many consults we can get in a day. Some days we see 0 new patients, and other days we can see up to 9. So just very variable, and your day just, you never know what's going to come in. So it's always kind of keeps you on your toes. Okay, so the other thing I wanted to talk about that we do throughout the week is didactics. So there are didactics on the surgery service, or like classroom learning time. And it happens on this service on Tuesday mornings from like 7 to 10 a.m. And what's kind of interesting about this one is that for most of the time they're talking about, like surgery things, so like surgical techniques and procedures and everything like that. And I feel like going into anesthesia, that's actually very helpful for me because I can kind of learn about the different procedures and like what they're thinking and, like how they're going about it. So I feel like that's actually very useful information for me, which is really nice. The other part of didactics is something called M&M, or the morbidity and mortality, where essentially residents have to go and talk about cases that they've done that have had not the best outcomes, and really just like talk about what happened, what they would do to prevent it. And yeah, they have to talk about it. And it's honestly pretty tense during those moments because, the residents are talking about these cases and the attendings are kind of like questioning them and asking them all these things, and you can feel kind of a little bit more pressure with that, and it's pretty tense. Thankfully it's only once a week, but when it's happening it's kind of like, ooh, okay. All right. Well, that's really all that I have for you guys for this week. It's not a ton of new information, but hopefully helpful and giving a really rounded picture of what we do on the general surgery service. I'm sure I'll learn more in these next 2 weeks, but that's really all that I have for you today. Let's go ahead and finish this video by talking about how many hours I work this week. So I will go ahead and pull that up now and we can take a look at it. Yep, still working 6 days a week, and my day off is still Thursday. That's the day it'll be for the rest of this rotation. And I will say it's kind of hard not having a weekend day off, but that's okay. Just got to push through. So yeah, this week was a little bit lighter. My senior let us go early both weekend days, which is really nice, as early as 2:30 on Sunday. And that obviously just felt so nice to go home and to be able to enjoy the day just a little bit more. So I worked a total of 64.5 hours, a little bit less than last week. Still feeling, pretty tired and everything, but we are getting through it. Okay, so that's everything for today. Thank you so much for coming along with me as I am documenting my journey. I still have 2 more weeks on this service, so I'll be back to report more all things general surgery. All right, take care.